You're wanting to really get to grips with a topic, right? Find the key stuff without digging through tons of text for hours.
Yeah, that's the idea.
That's what we do here. Today, we're diving into something pretty common, unfortunately, for dog owners: chronic diarrhea.
Mm-hmm.
We're talking about when a dog's poop changes, more often, looser, maybe bigger amounts, and sticks around for what, longer than 3 weeks?
That's the general definition, yeah. More than 3 weeks. It can be really tough for owners and vets to pin down.
Definitely. We've got some good sources here, and our mission, really, is to pull out the absolute must-know info.
Exactly. So you can get a solid understanding of chronic diarrhea in dogs without feeling completely overwhelmed by all the details.
Let's make sense of it.
Hmm.
Okay, so basics first. Chronic diarrhea, over 3 weeks of changes in frequency, consistency, or volume.
Correct. And importantly, it's not just one location. The problem could be starting in the small bowel.
Or the large bowel.
Or sometimes it's a mix of both involved.
So the sign might look similar on the outside abnormal poop, but what's actually going on inside the dog can be quite different.
That's a key point. Internally, you might have the intestines secreting too much fluid, almost like they're leaking water.
Uh-huh.
Or maybe undigested food is sitting there pulling water into the gut osmotically.
Okay.
Then there's the possibility the gut lining itself gets damaged, more permeable, sort of leaky.
Leaky gut, yeah.
And sometimes it's about motility, how things move through. It might be too fast or even too slow in parts. Often it's a combination of these mechanisms at play.
Right, not just one simple thing usually.
Right.
It sounds like it's definitely more complicated than just a tummy bug that won't quit.
Oh, for sure.
When a dog's dealing with this chronically, what parts of their body are actually impacted? Is it just the gut?
Well, the gastrointestinal system is ground zero, obviously, but chronic issues can have wider effects. We need to think about their endocrine system, so hormones and metabolism.
Okay.
The exocrine pancreas, absolutely crucial for making digestive enzymes.
Right.
How the body's managing fluids and electrolytes is critical too. And even the lymphatic system is involved, especially with fat absorption and immunity within the gut.
So it really ripples outwards. It's not just isolated to the bowels.
Precisely. It's very interconnected.
Okay, so one of the first things vets try to figure out, you mentioned, is where the problem mainly is small bowel or large bowel. What clues might an owner see at home?
Yeah, that differentiation is super helpful. For small bowel diarrhea, typically the volume of each poop can be normal or even increased.
Lower volume. Okay.
Yeah, and frequency might not be dramatically higher, maybe say 2 to 4 times a day, sort of in the normal range or just slightly up.
Right.
But because the small intestine is where nutrients get absorbed, weight loss is a really common sign.
That makes sense.
And sometimes, weirdly, their appetite might actually go up. It's like their body knows it's not getting the nutrients, so it craves more food.
Yeah.
Polyphagia, we call it.
Trying to compensate.
Exactly. Another potential clue, and it's a significant one, is melena. That's dark, black, terry-looking stool. It's actually digested blood, usually indicating bleeding somewhere higher up, like the stomach or small intestine.
Wow, okay. That sounds pretty serious. What about large bowel signs? How do they differ?
With large bowel issues, it's almost the opposite in some ways. The individual poops are often smaller, maybe little squirts sometimes,
Right.
but the frequency shoots way up, often more than 4 times a day, sometimes much more. They seem like they always have to go.
That sounds stressful for the dog.
It really can be. Weight loss is less common compared to small bowel problems. But you might see frank, red blood in the stool that's called hematochezia.
Fresher blood. Okay.
Yeah. And mucus is also really common with large bowel irritation. You might also notice straining tenesmus, where they're trying to go, maybe nothing much comes out, or dyschezia, which is difficulty or pain when pooping. Urgency is a big feature.
Straining and urgency. Got it. What about things like gas or vomiting?
Things like flatulence, those rumbling tummy noises, vorborygmus, and even vomiting can actually happen with both small and large bowel diarrhea. So they're not always the best indicators to pinpoint the location on their own.
Okay, so those are less specific. So those are things we might see at home.
Yeah.
What about during a vet's physical exam? What might they find that points towards a small bowel origin?
Good question. With small bowel disease, especially if there's malabsorption or significant protein loss, what we call protein-losing enteropathy or PLE,
PLE, right.
the dog might be quite thin, in poor body condition. Dehydration can also be a factor. When the vet feels the abdomen, they might detect thickened loops of small intestines.
Thickened loops, inflammation. or something
Could
else?
be inflammation, yeah, like an IBD, or it could potentially be a sign of a mass, maybe even a foreign body causing irritation or enlarged lymph nodes nearby.
Okay.
Interestingly, though, the rectal exam feeling inside the rectum is often pretty unremarkable in small bowel cases because the problem is much higher up.
That makes sense. The issue isn't down there.
Yeah.
So flipping it, what might a vet find on exam if it's primarily a large bowel problem?
With large bowel colitis, the dog's overall body condition is often better. They might not be as thin or dehydrated.
Uh-huh.
Palpating the abdomen, the vet might feel a thickened large bowel wall, or, again, potentially a mass or a foreign object lodged lower down.
And the rectal exam.
That's often where you do find abnormalities with large bowel issues. The vet might feel irregularities in the rectal lining, maybe polyps or masses, strictures in narrowed areas, or possibly enlarged lymph nodes in that pelvic region.
Okay, so the exam findings can really help narrow it down too. Now, the million-dollar question, the why. What are all the potential underlying causes? It sounds like the list could be massive.
You're absolutely right. It's extensive. Let's break it down. For small bowel diarrhea, we can kind of group the causes.
Right.
First, you have primary diseases of the small intestine itself. Big category here is inflammatory bowel disease, IBD. And that's not just one thing. There are different types based on the cells involved, like lymphoplasmacytic enteritis being very common.
Right.
Then there's lymphangiectasia. That's a condition where the little lymphatic vessels that absorb fat in the gut wall get dilated and don't work properly.
Lymphangiectasia.
Of course, neoplasia or cancer is always a concern. Infections are another major group bacterial, like Salmonella or Campylobacter.
Right.
Viral, like parvovirus, especially in younger dogs, or coronavirus. Fungal infections like histoplasmosis or pethiosis, particularly in certain regions. And parasites, Giardia, hookworms, roundworms.
So many infections.
Absolutely. We also have to consider partial obstructions, maybe a foreign object that's not causing a full blockage but is irritating things, or an intussusception.
Right.
There's also something called antibiotic responsive diarrhea, or ARD, sometimes called dysbiosis now. It seems linked to an imbalance of gut bacteria.
Little beat.
And then, if a dog has had surgery to remove a large section of their small intestine, they can develop short bowel syndrome.
Wow, that's a lot just under primary small intestinal disease.
It is. But broadly, it's about inflammation, damage, infection, or blockage within the small bowel itself.
What else causes small bowel problems?
Well, moving beyond the intestine itself, you can have problems with digestion. The classic example is exocrine pancreatic insufficiency, or EPI.
EPI, where the pancreas doesn't make enough enzymes.
Exactly. Food isn't broken down properly. Or you could have a lack of bile salts getting into the intestine, maybe due to liver or gallbladder disease, which messes up fat digestion.
Ah, okay.
Dietary factors are huge culprits too. Things like food-responsive enteropathy, basically. The gut reacting badly to certain food components.
Like an intolerance.
Sort of, yeah. Or a true food allergy. Even just switching diets too quickly can trigger it. There's also a specific condition in Irish setters related to gluten.
Gluten sensitivity, like in people.
Kind of analogous, yes. And finally, don't forget systemic or metabolic disorders. Things like liver disease, kidney failure causing uremic gastroenteritis, Addison's disease, hypoadrenocorticism.
Addison's can cause diarrhea.
Oh yes, chronic diarrhea can definitely be a sign. Also, exposure to toxins or adverse reactions to medications.
Man, the list just keeps going. Okay, deep breath. Let's switch to the large bowel. What kind of things cause chronic diarrhea originating there?
Okay, large bowel causes. Again, we see similar categories. Primary large intestinal diseases include inflammatory bowel disease, but specific types affecting the colon, like plasmacytic lymphocytic colitis or maybe eosinophilic colitis.
So IBD can affect the large bowel too.
Definitely. Neoplasia cancer can occur in the colon or rectum. Infections are also possible, things like Clostridium perfringens, enterotoxicosis, or Clostridioides difficile.
C. diff, like in humans.
Yep. And certain parasites have a preference for the large bowel, like whipworms, Trichuris vulpus. They can be tricky to find sometimes.
The worms.
Things like oleocolic intussusception, where the small bowel telescopes into the large, or cecal inversion can also cause large bowel signs.
What about non-disease causes, like diet?
Diet is a big factor here, too.
Yeah.
Dietary indiscretion, eating garbage, spoiled food, weird stuff.
Ah, yes, the classic Labrador move.
Huh, exactly. Sudden diet changes, again. Food-responsive enteropathy can manifest with large bowel signs and swallowing foreign material that irritates the colon.
Okay. Anything else for large bowel?
There's also irritable bowel syndrome, or IBS.
Right.
This is considered more of a functional disorder, often linked to stress, where the bowel itself might look normal, but motility and sensitivity are off.
IBS. Interesting. So with this huge range of possibilities for both small and large bowel, are there specific risk factors? Are certain dogs just more prone to this?
Yeah, we do see some tendencies. For small bowel issues, as we mentioned, abrupt diet changes are a common trigger. Feeding foods that are poorly digestible or really high in fat can also set some dogs off.
High fat.
We see antibiotic responsive diarrhea, that ARD dysbiosis, more often in large breed dogs. German shepherds seem particularly predisposed.
German Shepherds again.
Yeah, and interestingly, large breeds are also more prone to intestinal torsions or twisting, and sometimes that seems linked with EPI.
Hmm.
And that fungal infection, pitheosis, it tends to affect young, large breed dogs, often males that live in rural areas, especially near the Gulf Coast, spending time in swampy water.
Very specific risk factors there. What about for large bowel diarrhea?
For the large bowel, again, dietary changes and indiscretion are major players. Stress can definitely be a trigger for flare-ups, especially in dogs perhaps prone to IBS-like signs.
Stress colitis, people sometimes call it.
Exactly, that's often what they mean. Psychological factors can play a role. We also see breedlings here. Boxers and also French bulldogs, especially when they're young, under 3 years old, have a much higher risk of a specific severe form of IBD called histiocytic ulcerative colitis.
Boxers and Frenchies.
And similar to the small bowel form, pitheosis affecting the large bowel is also seen more in those large breed dogs that are outdoors a lot in endemic areas.
Right. This complexity is really hitting home. So how on earth do vets start sorting through all this? What's the typical diagnostic journey look
This
like?
really is a process, often one of elimination.
Yeah, it sounds like it.
The absolute first step, as we discussed, is trying to localize the problem. Is it primarily small bowel, large bowel, or mixed? Using the history the owner provides and the physical exam findings.
Using all those clues we talked about.
Precisely. Then we move on to laboratory tests. A minimum database, usually a complete blood count, CBC, a serum biochemistry profile, and a urinalysis gives a broad overview.
What can those tell you?
Lots of potential clues. For instance, high eosinophils on the CBC might suggest parasites, allergies, or eosinophilic IBD. Low lymphocytes or low cholesterol can be a red flag for lymphangiectasia or severe IBD. Anemia could point to chronic blood loss, maybe from an ulcer or tumor. And low protein levels, especially both albumin and globulin being low panhypoproteinemia, is a hallmark of that protein-losing enteropathy, PLE.
Right. The PLE.
Plus, these tests help screen for those other systemic diseases we mentioned, like kidney or liver problems or Addison's.
So blood work gives that baseline system check. What about looking at the poop itself?
Oh, absolutely critical. Fecal examinations are essential. We do direct smears to look for certain things, flotation tests, often using centrifugation, which is more sensitive, to find parasite eggs like whipworms or roundworms. Giardia often needs special tests, like an ELISA antigen test.
Multiple samples needed sometimes.
Yes, definitely recommend multiple samples, maybe over 3 to 5 days, because things like Giardia cysts and whipworm eggs aren't shed continuously.
Got it.
We might also do a fecal cytology or a rectal scraping cytology, looking at the cells under a microscope, which can sometimes show unusual bacteria like Clostridium, fungi, or inflammatory cells.
What about those PCR tests for infections?
PCR tests look for the DNA of specific pathogens. They can be useful, but interpretation needs care.
Why is that?
Because many bacteria and even some viruses or protozoa can be found in the feces of perfectly healthy dogs. So a positive PCR doesn't automatically mean that organism is causing the diarrhea. It has to fit with the clinical signs and other findings.
Context is key.
Exactly. If we suspect a specific bacterial cause like Salmonella or Campylobacter, we might need to do a fecal culture, often requiring special growth media and conditions.
Okay. And you mentioned the pancreas EPI. How's that diagnosed?
For exocrine pancreatic insufficiency, the gold standard test is the canine-specific TLI trypsin-like immunoreactivity. It measures a precursor enzyme from the pancreas in the blood. Low levels confirm EPI.
TLI for EPI. Got it. Any other important blood tests?
Yes, tests for malabsorption can be really helpful. We often measure serum folate and cobalamin, that's vitamin B12.
Folate and B12, what do they tell you?
Generally, folate is absorbed in the upper small intestine, the jejunum. Low folate might suggest disease there, while sometimes high folate can hint at bacterial overgrowth. Cobalamin, B12 is absorbed way down in the lower small intestine, the ileum, and requires pancreatic factors. So locobalamin is common with EPI, or diseases affecting the ileum.
Very useful information there.
And then for metabolic diseases, we might run a baseline cortisol level as a screening test for Addison's disease. If it's normal, Addison's is very unlikely. If it's low, we'd need further testing like an ACTH stimulation test. Bile acid tests can assess liver function if we suspect hepatobiliary disease.
Okay, that covers a lot of the lab work. What about imaging like X-rays or ultrasound?
Imaging is often the next step. Standard abdominal X-rays or radiographs can sometimes show obvious things like a foreign body causing an obstruction, abnormal gas patterns suggesting ileus or blockage, maybe enlarged organs, or signs of fluid in the abdomen.
But maybe not subtle things.
Right. Subtle changes in the bowel wall itself are hard to see on plain X-rays. Contrast studies where the dog swallows barium used to be done more often to outline the inside of the gut.
Barium studies, yeah.
But abdominal ultrasound has largely taken over because it gives us so much more detail about the soft tissues.
What can ultrasound show specifically?
Ultrasound is fantastic for looking at the layers of the bowel wall. We can measure their thickness, assess the layering pattern, which can be disrupted with inflammation or infiltration like cancer.
Wow.
It's great for finding masses, foreign bodies that X-rays might miss, intussusceptions, enlarged abdominal lymph nodes, and assessing other organs like the liver, pancreas, spleen, kidneys. It's a really powerful, non-invasive tool.
Sounds invaluable.
Yeah.
So what if all these tests, history, exam, labs, imaging, still don't give a definitive answer? What are the next steps? More invasive things.
Sometimes, yes. If the dog is stable and we've ruled out major issues like obstructions or infections, a dietary trial is often a really sensible next step.
The elimination diet.
Exactly. Switching to a diet with a novel protein source, something the dog hasn't eaten before, or a hydrolyzed protein diet, where proteins are broken down so small the immune system doesn't react. Usually needs a strict trial for at least 2, maybe up to several weeks.
And if that doesn't work or isn't appropriate?
Then we often need to get actual tissue samples, biopsies from the intestines. Endoscopy is a common way to do this.
Putting a camera down.
Yeah, either down the throat into the stomach and upper small intestine, upper GI endoscopy, or up the rectum into the colon, colonoscopy. It lets us see the lining directly and take multiple small pinch biopsies.
Multiple biopsies are important.
Crucial. You need several samples from different areas because the disease might be patchy, and sometimes the way it looks visually doesn't perfectly match the microscopic findings. But endoscopic biopsies are small and only get the very inner lining, the mucosa.
So they might miss deeper problems.
They can, yes. If we suspect disease deeper in the wall, or in areas the scope can't reach, like the mid-small intestine, we might need full-thickness biopsies. These can sometimes be obtained via laparoscopy keyhole surgery, or more traditionally, via open abdominal surgery.
Surgery for biopsies.
You're correct. Surgery has the advantage that you can see and feel everything, take samples from multiple organs if needed, and potentially fix certain problems at the same time, like removing a foreign body or a mass.
Are there other ways to get samples? Like needle aspirates?
Ultrasound-guided fine needle aspirates can sometimes be useful, especially for diagnosing certain types of tumors like lymphoma and lymph nodes or the gut wall. But there's a small risk of complications like seeding tumor cells, and the sample is just cells, not tissue architecture, so it has limitations compared to biopsy.
Right. So finally, we hopefully have a diagnosis. How do we treat chronic diarrhea?
Well, the absolute ideal is to treat the specific underlying cause we found. If it's EPI, they need lifelong enzyme supplements. If it's a parasite, specific dewormers. If it's food responsive, the diet change is the treatment.
Makes sense.
And actually, studies suggest a significant number of dogs with chronic, uncomplicated diarrhea will respond well just to an appropriate dietary trial.
So diet is often key.
Very often. Even in cases like IBD, dietary management is a cornerstone. We might use those novel protein or hydrolyzed diets, or sometimes highly digestible low-fat diets or fiber-supplemented diets, depending on whether it's small or large bowel and the specific condition.
What if diet alone isn't enough?
Right. If simply changing the diet doesn't resolve things, or if we have a diagnosis like moderate to severe IBD or cancer, then we need other treatments. But constantly switching foods without a diagnosis isn't usually helpful and often just delays getting to the root of the problem.
Good point. What about supportive care? fluids and things.
Absolutely vital, especially early on or during flare-ups. If the dog is dehydrated or has electrolyte imbalances, fluid therapy, sometimes subcutaneous fluids at home, sometimes intravenous fluids in hospital is crucial. If they have that severe protein loss, PLE, they might need plasma transfusions or special intravenous fluids called colloids to help maintain their fluid balance and protein levels.
Okay. And surgery. Is that just for diagnosis?
Mainly for diagnosis biopsies or if there's something specific to fix, like an obstruction, a mass that can be removed, or correcting an intussusception. It's not usually a primary treatment for inflammation itself.
Got it. What about medications? What drugs are commonly used?
It really depends heavily on the diagnosis. For IBD, the mainstay is often corticosteroids like prednisone or sometimes budesonide, which acts more locally in the gut with fewer systemic side effects.
Steroids. Okay.
In more severe or refractory cases, we might add other immunosuppressive drugs like cyclosporine or azathioprine, but these need careful monitoring.
Right.
We talked about low cobalamin, B12, being common. Supplementing that, usually by injection initially, is often really important for gut healing and function.
B12 shots.
Yep. For antibiotic-responsive diarrhea, ARD, specific antibiotics like tylosin or metronidazole are used, sometimes long-term or pulsed. There's also growing interest in probiotics giving beneficial bacteria to help restore a healthy gut microbiome, though the evidence is still evolving for specific conditions.
Probiotics.
Yeah.
Interesting. Are there any medications that should be avoided?
Generally, we try to avoid drugs that slow down gut motility too much,
Yeah.
like older anticholinergic drugs or even sometimes opioids, unless there's a very specific reason. While they might reduce frequency temporarily, they can sometimes worsen bacterial overgrowth or mask underlying issues. They might have a limited role in some cases of IBS cramping, though.
Okay, good to know. So once treatment starts, what does follow-up look like? How do you monitor progress?
Close monitoring is key. Owners need to track stool frequency and consistency, maybe using a fecal scoring chart. Appetite, activity level, and body weight are also really important indicators.
Keep a diary, maybe.
That can be super helpful, yeah. For dogs with PLE, we need to recheck their serum protein levels, albumin and globulin, and sometimes cholesterol periodically, alongside watching for clinical signs like edema or fluid in the abdomen.
How quickly should things improve?
Improvement is often gradual with chronic conditions. It's not usually an overnight fix. If the dog isn't responding as expected within a reasonable time frame, say a few weeks, then it's time to reassess. Maybe the diagnosis needs revisiting or the treatment plan needs adjusting.
And what are the potential complications if things don't get under control?
Ongoing dehydration and electrolyte issues are a risk. Progressive weight loss and malnutrition, obviously. If there's fluid buildup in the abdomen or under the skin edema, that's usually related to the underlying cause, often severe protein loss. And the complications of PLE itself can be significant.
This has been incredibly insightful. Thank you. It's crystal clear that chronic diarrhea in dogs isn't just, a simple upset stomach that lasts too long.
Not at all.
It can signal a huge variety of underlying problems, sometimes quite complex, involving different body systems.
Absolutely. And that really underlines why that methodical diagnostic approach is so critical to peel back the layers and find the actual root cause.
It really gives you an appreciation for the different diagnostic tools and treatment strategies available. Understanding the possibilities helps make sense of the process.
Exactly. From dietary tweaks to managing complex inflammatory diseases, it covers a wide spectrum.
And it's a powerful reminder of how interconnected the body is, isn't it? A gut problem might really be linked to the pancreas or the immune system or liver.
It's all tied together.
So maybe a final thought for our listeners to chew on. Given this incredibly wide range of potential causes we've discussed and the often detailed step-by-step diagnostic process required, what does that really tell us about the importance, the necessity of a truly comprehensive and individualized approach when it comes to veterinary care for our dogs?
That's a great question to ponder. How crucial is that tailored investigation for each individual case?